Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Hypersexuality: what causes it and how to get help. Hypersexuality is defined as an obsessive urge or impulse to engage in various kinds of sexual activity, including excessive masturbation or use of pornography. The terms sex addiction and compulsive sexual behavior are often used interchangeably with hypersexuality disorder. /r/n/r/n when any sexual behavior results in adverse consequences at home, work, or school, or is used as an escape mechanism, it signals a problem. /r/n/r/n hypersexuality may include unprotected sex or urges so strong they disrupt a person's ability to function normally in day-to-day life. /r/n/r/nFrank and Helena Getty ImagesrnrnNymphomania is an outdated term previously used to describe excessive sexual desire in women. /r/n/r/n research estimates that 8.6% of people in the US deal with hypersexuality, compulsive sexual behavior, or sex addiction. The condition predominantly affects men. /r/n/r/n people with hypersexuality disorder may engage in activities such as /r/n/r/n sexual thoughts, urges, or behaviors can have negative consequences when a person is preoccupied with them, and they begin to take up more space in their minds and lives. /r/n/r/n fantasies and urges may feel intrusive, intense, and challenging to change or manage. These compulsions or actions can significantly affect a person's quality of life and create both personal and professional problems. /r/n/r/n hypersexuality disorder is not included in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the American Psychiatric Association's Handbook for Diagnosing Mental Health Conditions. /r/n/r/n because of this, mental health professionals go back and forth on how to classify compulsive sexual behavior. Currently, hypersexuality disorder is characterized similarly to impulse control disorders and behavioral addictions. /r/n/r/n compulsive sexual behavior disorder, CSBD, is classified under the International Classification of Disease, 11th revision, ICD 11, as an impulse control disorder. It defines CSBD as a persistent pattern of failure to control intense, repetitive sexual impulses or urges resulting in repetitive sexual behavior. /r/n/r/n compulsive sexual behavior can present differently, as there are different types of sexual behaviors. Symptoms include /r/n/r/n excessive sexual behavior can lead to a greater risk of contracting STIs. Therefore, those with hypersexual behavior should discuss screening for STIs with their healthcare provider and consider starting pre-exposure prophylaxis, PrEP, to prevent HIV infection. /r/n/r/n symptoms of hypersexuality disorder or sex addiction may include /r/n/r/n more research is needed on the cause of hypersexuality. However, a review of the literature on hypersexual behavior has identified several factors that may lead to hypersexual behavior, including /r/n/r/n individuals with easy access to sexual content or material may have a higher risk of developing compulsive sexual behavior. Additionally, mental health conditions such as anxiety, depression, or addiction may also be risk factors. /r/n/r/n it may be time to contact a healthcare provider if you /r/n/r/n if you are having suicidal thoughts. Dial 988 to contact the 988 Suicide and Crisis Lifeline and connect with a trained counselor, or text HOME to 741 to 741 to reach a crisis counselor at the crisis text line. If you or a loved one are in immediate danger, Call 911.r/n/n/r/n. There are no specific diagnostic criteria for hypersexuality disorder since it is not included in the DSM-5 as a formal diagnosis. /r/n/r/n. Clinicians assess patients similarly to how they would for any other mental health condition. Some mental health professionals use the criteria for compulsive sexual behavior disorder in the ICD-11. They may also use the criteria for addictive disorders since hypersexuality can be considered a form of behavioral addiction. /r/n/r/n. Consultation with a medical healthcare provider may be recommended to rule out other conditions before a mental health assessment. /r/n/r/n. A mental health care counselor will go over a person's thoughts and behaviors related to sex, especially those that feel difficult to control. To get a complete picture of someone's health and how they are impacted by compulsive sexual behavior, a counselor may ask about /r/n/r/n. Additionally, significant or stressful life events and feelings of guilt, shame, remorse, or low self-esteem may be explored. A screening tool may be used to gauge symptoms. /r/n/r/n. People living with hypersexuality disorder may experience complications such as /r/n/r/n. As mentioned, hypersexuality disorder may adversely affect personal relationships, your sense of well-being, and your ability to function in daily life. /r/n/r/n. People with hypersexuality disorder may experience /r/n/r/n. Treatment for compulsive sexual behavior can vary based on underlying issues. /r/n/r/n. For example, research has found that males with hypersexuality disorder are more likely to have other mental health problems. One study found that around 41% of males seeking treatment for casual sexual behavior or excessive pornography use met the criteria for a substance abuse disorder, while around 40% met the criteria for an anxiety disorder, and 71% met the criteria for a mood disorder. /r/n/r/n. Although hypersexuality is not a symptom of ADHD, studies have also found that childhood ADHD may be associated with hypersexual behavior as an adult. /r/n/r/n. If a mood disorder, anxiety disorder, or substance use disorder is the cause, a healthcare provider may recommend the following medications: /r/n/r/n. Individual, family, or group therapy can occur in inpatient or outpatient settings based on a patient's needs. /r/n/r/n. Psychodynamic therapy may help patients identify triggers and examine feelings of guilt, shame, and self-esteem that may contribute to hypersexuality. /r/n/r/n. In cognitive behavioral therapy, patients learn to recognize unhealthy beliefs about themselves and their sexual behavior and develop tools to manage complex thoughts and emotions to sustain healthy behaviors. A therapist may introduce techniques like acceptance and commitment therapy, coupled with practicing mindfulness. /r/n/r/n. Seeking support through a self-help group is another option that a mental health professional may suggest in conjunction with therapy. Based on the 12-step theory, groups like Sex Addicts Anonymous can help people with compulsive sexual behavior find a sense of community in recovery. /r/n/r/n. Learning to cope with hypersexuality and its impact on your life is essential to recovery. Strategies that may be useful include /r/n/r/n. Hypersexuality describes an obsessive urge or desire to engage in sexual activity, including unprotected sex. People with this condition may also experience strong emotions like shame, remorse, or depression. This kind of compulsive sexual behavior can negatively affect your relationships. /r/n/r/n. Hypersexuality can have various causes, including past trauma, certain medical conditions, and medication side effects. Treatment depends on the underlying cause but may include medication, therapy, and support groups. /r/n/r/n. rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.